Stem cell research and tissue engineering are slowly changing how doctors think about treating injuries, degeneration, and lost function, but the reality is more grounded than many headlines make it seem. Along with real progress in rebuilding blood cells, improving vision, repairing cartilage, and developing bioprinted tissues, scientists are now studying whether stem cells can help people regain mobility after spinal cord or neurological injuries. In some early studies, patients have shown improvements in balance, strength, or the ability to stand or walk with assistance. This video looks at what stem cells can truly do today, where promising research is happening in mobility, teeth, hearing, vision, and joints, and why full organ regrowth and complete recovery are still long-term goals rather than everyday medical treatments. Before we get started, please consider hitting the like button and subscribing to the channel. It only takes a second, and it really helps support my work. Thanks for watching, and let's dive in. We begin with a look at the most proven and widely used stem cell treatments. They are for blood and immune system diseases. Bone marrow and blood stem cell transplants have been used for decades to treat certain cancers like leukemia and lymphoma, as well as inherited blood disorders. In these cases, stem cells can fully rebuild a patient's blood-forming system, and these treatments are well regulated and part of standard medical care. Outside of blood disorders, progress is real but more limited. In eye disease, stem cell-based treatments for inherited retinal conditions and macular degeneration have reached early human trials. Some patients have experienced real improvements in vision, but these therapies are still experimental and only available through carefully controlled studies. In orthopedics, mesenchymal stem cells are being studied for joint pain and mobility, especially in osteoarthritis. But strong, long-term proof that they can fully restore damaged cartilage is still lacking. Research into dental regeneration has already reached human clinical studies, but only for parts of the tooth, not for fully replacing a missing tooth. Clinical trials using dental pulp stem cells have shown that it is possible to regenerate the soft tissue inside a tooth, restoring living pulp and supporting dentin formation in cases where the tooth structure is still present. These studies demonstrate that stem cells can safely help repair damaged teeth from the inside, particularly in immature or injured teeth. Regrowing an entire new human tooth, however, remains experimental. While scientists have successfully grown bioengineered tooth buds in animals that develop into functional teeth, this work has yet to be translated into a proven human stem cell tooth replacement. A separate and newer approach has entered early human trials in Japan, using a drug that blocks the USAG1 protein to stimulate dormant tooth-forming signals, rather than transplanting stem cells, but results are still pending. For now, fillings, root canals, implants, and bridges remain the practical solutions for missing teeth, while true biological tooth replacement is still under active research rather than routine clinical care. At the moment, there are no approved stem cell treatments for hearing loss, but the field is actively moving forward. Several clinical trials are testing therapies for sensorineural hearing loss, which is caused by damage to inner ear hair cells or auditory nerves. In 2025, the UK company Reliably Therapeutics began a first-in-human trial of Rinsel-1, a treatment designed to regenerate auditory neurons in people receiving cochlear implants. Early results are expected after the first year, but routine clinical use is still a long way off. Vision research is slightly further along. Companies like Luxa Biotechnology are testing stem cell-derived retinal cells for dry, age-related macular degeneration. Early trials have reported vision improvements in some patients, and newer studies are now testing higher doses and longer follow-up periods. Even so, these treatments remain experimental and tightly regulated. Cartilage repair has been one of the most heavily studied uses of stem cells outside of blood diseases. Mesenchymal stem cells taken from bone marrow, fat, or joint lining have been studied for more than 15 years in osteoarthritis and cartilage injuries. Many studies show reduced pain and better joint function, but restoring cartilage to a truly normal and long-lasting state has been inconsistent. Japan has been a leader in moving this research closer to real-world use. Osaka University launched a Phase 3 trial using sheets of stem cells taken from joint tissue to repair knee cartilage, working with companies like 2Cells and Chugai Pharmaceutical. This large, regulated study aims to clearly test safety and effectiveness. By contrast, many private stem cell injections marketed to athletes or arthritis patients are ahead of the science, showing reasonable safety but mixed and still preliminary long-term results. 3D bioprinting is already widely used in research. Scientists can print living tissue models to study diseases and test drugs without relying entirely on animal experiments. However, fully functional, transplant-ready human organs do not yet exist. Major companies and research groups working in this area include Bico Group, Organovo, 3D Systems, Merck KGaA, Colplant, Regan HU, Aspect Biosystems, and many teams across Japan, South Korea, and China. Current clinical goals focus on simpler structures like skin grafts, cartilage patches, and small tissue sections for organs such as the liver or pancreas. Printing whole kidneys, hearts, or lungs remains one of the hardest challenges in medicine and is not expected to become routine anytime soon. Research aimed at helping people stand or walk again has mainly focused on spinal cord injuries, stroke recovery, and certain neurological diseases. Several early clinical trials suggest that stem cell treatments can improve mobility, balance, and muscle control in some patients, especially when combined with intensive physical rehabilitation. In spinal cord injury, transplanted stem or progenitor cells are being studied for their ability to reduce inflammation, protect surviving nerve cells, and help reconnect remaining neural pathways. While dramatic recoveries are rare, some patients in controlled trials have regained limited voluntary movement, improved core stability, or the ability to stand or walk with assistance. These changes can make a meaningful difference in independence and daily life. Importantly, these improvements usually come from strengthening and supporting existing nerve circuits, rather than fully repairing the spinal cord itself. Using a patient's own stem cells can lower the risk of immune rejection, but it does not remove it entirely. This is especially true for induced pluripotent stem cells, which are created by reprogramming adult cells and can sometimes trigger immune responses. Researchers are working on better production methods, gene editing techniques to make cells less visible to the immune system, and short-term immune-suppressing treatments used only around the time of transplantation. Some advanced programs intentionally use donor cells instead of patient-specific ones. The Osaka Cartilage trials, for example, rely on banked donor cells to ensure consistent quality and large-scale production, even if that means careful immune matching or limited immunosuppression. This reflects a broader balance between personalized medicine and practical, scalable treatments. Stem cell therapies that improve walking or standing ability follow the same long development process as other regenerative treatments. Early trials may show improvements within months, such as stronger muscles, better balance, or longer assisted walking distances, but proving lasting benefit requires large studies that run for many years. Most stem cell treatments for spinal cord injury and neurological mobility loss are still in Phase 1 or Phase 2 trials, focused on safety and early signs of benefit, rather than guaranteed recovery. These treatments are best understood as mobility-enhancing rather than curative. The most realistic short-term outcomes include standing with support, improved walking with assistive devices, or better control of posture and bodily functions, not a full return to pre-injury mobility. As with vision, joints, and dental repair, combining stem cell therapy with rehabilitation is critical, and future progress will likely come from coordinated treatment programs rather than stem cells alone. Stem cell research is beginning to show that improving mobility, including the ability to stand or walk with assistance, is biologically possible for some people with spinal cord or neurological injuries. These advances are meaningful, but they are not yet reliable cures. Most treatments remain experimental, and results vary widely depending on the type of injury, how soon treatment begins, and the level of rehabilitation support. Alongside progress in vision, joint repair, dental regeneration, and tissue engineering, mobility research highlights both the promise and the limits of today's stem cell science. Step-by-step improvements are becoming achievable, but full and predictable recovery remains a long-term goal rather than an immediate medical reality. The future looks promising. What do you think? Leave me a comment, then check out some of my other videos. Don't forget to hit the like button and subscribe. Thanks again for watching, and we'll see you at the next one.